Garima Asati welcome you all in my YouTube channel. Friends, today I'm going to talk about the topic Otorrhea in English and the demand of few of my non-Hindi patients. So let's continue with the topic Otorrhea. In this, discharges from the ear occur, which may originate through ear canal or middle ear. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last, because in the last I am going to explain you about some of the homeopathic medicines which can be helpful in curing this Otorrhea. Now let's talk about the symptoms of this Otorrhea. So discharges from the ears occur. It may be liquid or transparent, or it may be like wax, which may be yellowish or thick. If there is severe infection, then it may also become purulent, that is pus-like. And along with this, the associated symptoms may be hearing loss with no pain, and pain occur only when there is severe infection. So these are the symptoms of Otorrhea. Now let's talk about the causes of this Otorrhea. So when external ear canal gets infected, so there are some causes regarding it. So the first one is acute otitis externa. When there is inflammation of the ear canal by any bacteria, it causes otalgia, that is pain in the ear, and otorrhea, that is discharges from ear, or dermatitis, that is psoriasis. When infects the ear, it can also lead to this otorrheal discharges. Or there may be chronic otitis externa, that is inflammation of the ear canal, which may be of chronic nature. So that is chronic one, and it is also because of bacteria. And the last one is furunculosa. So that is a painful boil may occur underneath the skin, which causes the pain in the ear as well as seropurulent discharges from the ear because of infection as well as inflammation. So these are the diseases or the causes regarding external ear. Now let's talk about the causes associated with the middle ear affection. So the first one is chronic suppurative otitis media, tubo-tympanic variety. So in this, rupturing of the tympanic membrane may occur, and due to severe infection or inflammation, it may fail to heal and causing perforation in the ear, and it leads to mucopurulent discharges from the ear. The next one is chronic suppurative otitis media atticoentral. In this, dysfunction of the eustachian tube can lead to perforation in the attic region of the ear or rupturing of the tympanic membrane. Along with it, cholesteatoma may develop, that is non-cancerous skin growth may develop in the middle section behind the eardrum. And the symptoms along with these varieties are scanty offensive discharge along with hearing loss, and bone erosion may occur, which may lead up to middle or posterior cranial fossa. Other causes may be any surgery of the mastoid region may lead to this Otorrhea, or fracture of the temporal bone may also lead to this Otorrhea. And the last cause is Otorrhea after using chromats. So it may be infected, which can lead to mucopurulent Otorrhea. Now let's talk about the diagnosis of this Otorrhea. History of reduced hearing, soft test or hearing test, biopsy, X-ray or examination of perforation of drum can be helpful in diagnosing this Otorrhea. Now let's talk about the management part of this Otorrhea. So antibiotics can be given for inflammation of this external or middle ear infections, or antibiotic drops are given for this in allopathic mode of treatment. Now let's talk about the homeopathic cause. One of the cured case of this Otorrhea via homeopathy, and some of the homeopathic medicines which can be helpful in curing this Otorrhea. So the homeopathic cause is that patient doesn't want to hear any unpleasant or disturbing message that disturbs him or hurts him, but he is unable to get rid out of that situation. Now let's discuss one of the cured case of this Otorrhea via homeopathy. A patient aged 45 years suffering from Otorrhea. There were severe discharges, purulent discharges from the left ear, and there was too severe violent stitching type of pain inside the ear, that is left one especially. And it has been since 2 years. After taking whole history, we got that she was having an extramarital affair with someone and she has been caught by her landlord, and she got a fear that she will be catched in future by her husband too, and she doesn't want to hear that unpleasant thing from husband. She doesn't want to get scolded by him, and she doesn't want to open this affair matter in front of her husband. She was very fearful. There was fear of dark, fear of ghost, gets panic easily. And after taking whole history, I took the rubric delusion catches at appearance. And the medicine given was stramonium 200, which cured her completely within a period of only 4 months. Now let's talk about some of the homeopathic medicines which can be helpful in curing this Otorrhea. So the first medicine is graphitis. So the discharges from the ear of this graphitis is bloody. It can be watery, it can be more liquid, but especially if the discharge is gluey, sticky, it must be graphitis. And ear feels stuffed most of the times, as if it is filled with something inside. If we talk about the mental symptoms of this graphitis, so patient is having disinclination to any kind of work. He is very much restless during the time of work and he is inclined to sit. There is weeping from music. He can't tolerate music and feels to forget everything whenever asked. So if these symptoms correspond, graphitis will be helpful in curing such Otorrhea. The next medicine is petroleum. So there is dry catarrh, that is dry eustachian catarrh, and the discharges are bloody or brownish in color. Along with it, there is severe itching within the ear. Now let's talk about the mental symptoms of this petroleum. So there is loss of memory. Patient thinks that he is double or he is having a third leg or someone is lying besides him. There is confusion while walking. So, if these symptoms correspond, petroleum will be helpful in curing such Otorrhea. That's all for today. We'll meet soon with a new topic, new subject. The clinic address of mine and the contact number is given in the description link. It's my humble request to you all, kindly don't take any medicine without consulting doctor, otherwise it will not be too much helpful for you all. And kindly subscribe my channel, tap the bell icon to get the latest updates of the videos. Stay connected to stay healthy. Thank you.